Thank you very much, Mr. Montoot. Pleasant good morning to everyone following us on live stream, on social media, in the diaspora, and wherever you may be at this moment. It is our usual Tuesday press briefing. And as you have heard this morning, I will deal with a number of the issues that have been raised. We would do some patois. But I want to take this first opportunity to congratulate and thank the people of Castries Southeast for turning out in massive numbers on Sunday for the constituency motorcade. Mwen vle di un special merci pour tout moun a Pawes Castries Southeast. Paske ou sorti dehors en grand limo, ek sa ki pate sa join nou en motorcade la, ou jwen epi nou le nou te ka pase an se diferent commune ou sorti dehors, ou te ka wave ou men bay jaune bokayou. Nou remercier tout moun en pile pour ça. Parce que ça ka moutwe en signe dat nou japawe pour nous satire gouvernement ça qui en pouvoir hodia. I want to also clarify something for the people of Saint Lucia and the labor rights who want to compare the events that are taking place. The UWP events are still our Sunday live. We are just taking some of our Sunday live events outdoors. We are not having a rally. We had one rally, and that was in Mikud. And the numbers in Mikud spoke for itself. These are just small community events that are taking place. Nobody is paid to attend. In most of the instances, you don't even hire vehicles for persons. They come on their own. It's only because we had a motorcade in Castries Southeast this time that some vehicles were hired to transport people. But while we had just about 40 hired buses, we had over 80 private vehicles in that motorcade. And I'm not here to boast about numbers and attendance. I want the people of Saint Lucia to open their eyes to the reality that there is a momentum with the United Workers' Party, and there is a shift, a major shift from the Labour Party because of the disappointment that the people of Saint Lucia have over the present state of governance. So I thought I needed to clarify this so that people are not confused to try and compare events. When we have a rally, we will not enclose the space with containers and tents. We leave it open because we know wherever we go, we are going to fill up the space. I will focus a bit on what my colleague, Mr. Fevrier, highlighted. And I have a reason to focus on this first and foremost because I was the minister responsible for housing in 2018. My colleague, Mr. Montoot, would recall that at more than 3 cabinet meetings, Mr. King came in insisting that he wanted the lands of La Clary to be transferred to Invest Saint Lucia in order to facilitate a development plan. And he indicated that he had his investors and everything was lined up to build that town center that would accommodate the residents of the area and business people in the Laclery area and environs. The record is there to show in cabinet when the transfer was made to Invest Saint Lucia. The chairman of Invest Saint Lucia was consulted, and it was supposed to be a project implemented that would engage the local entities, the NIC, Invest Saint Lucia. You mean to put a little development in Laclery, we need to find a Nigerian investor to do so? Now, Saint Lucia, moi vle mande ko en question. Moi vle mande ko en question. Tessa c'était toujours te gouvernement. Il était transfert en bas non National Housing Corporation, NHC. Avant ça, c'était UDC, HUDC, Housing Urban Development Corporation. That was back in the days of Peter Philip, I think, was the minister responsible. Now, Kachilesa, depuis tant ça te ça sous non gouvernement Saint Lucia. Even yaba non NHC. Monsieur King a cabinet UWP that ite en pas en didan. Il m'a dit pour terre transfer. Nous dit nous kay develop terre la ni plan pour lui. Insist in a developer et c'est ça nous ka fait nous because nous porte transfer terre ça te ka chen ni de. So nous transfer terre bali by corporation et NIC te ka invest l'argent en dedans. C'est plan qui présenté by cabinet. Nous ka apprendre jodi a même monsieur King là a dans cabinet Labour Party via transfer terre aba National Housing Corporation. Première question pour ma décor, pour qui raison? Si nous pas te transfer terre côté ite mandé a, ça ite kay di gouvernement flambeau ite ka goumen contre li, c'est pour ça il quitte flambeau. Nous fait ça il mandé a. Il vient full circle et qui transfer terre via à bas NHC. Et bien cabinet Labour transfer et c'est monsieur King qui m'a dit pour transfer terre via. Now mi se pli go question à nous pour m'a dire. Premier ministre Philippe J. Pierre dit il pas connaître rien about ça. Monsieur King dit yo discuss ça en la Guinade. So question c'est qui moun qui ka menti? That is the real question that we need to ask ourselves in Saint Lucia. And I want Saint Lucians to recall the Prime Minister came and he made a statement about giving crown lands to the people who have been residing on it. Richard Frederick came and said it was not crown lands, it was private lands. So moi di jamais qui nous communiste Saint Lucia ou kay prend propriété en moun qui ni papier et ou kay just buy lot moun ni. En qui laisse pays côté ça ka fait en la terre. C'est ça monsieur Richard Frederick dit. Nous vietan un lot ministre gouvernement dit well c'est pas tout crown lands les nous parle about terre abandon. Qui moun qui te ka menti? Est-ce Philippe J. Pierre? Eh bien, est-ce ministre qui est pile? Today, we are faced with another situation where one minister is saying something and the prime minister is saying something completely different. Now, I cannot even ask about truth when it comes to these men and women who are representing us in Saint Lucia, because they speak more lies than they speak truth. So we have to ask about which one is lying. And if the minister spoke out and told a lie about the prime minister, you come in on television and you giving a press statement that you don't know anything about this. So what actions have been taken to reprimand the minister, for making statements? Or is that a case of another secret deal by another minister like Emma did with GPH, now this time with a Nigerian investor? So many businessmen in Saint Lucia, a prime piece of real estate, and it has to take a Nigerian to come and put a few little shops, a few little apartments in Saint Lucia, and you're talking about the Exim Bank. So I want to know, is that a high-rise building that's going to go there? Now we know high-rise buildings cannot go in proximity to the airport. So it can be a 50-story building that you're going to put there, that you need a Nigerian investor. Residents of La Clery, open your eyes. People of Saint Lucia, let us open our eyes. It was this Labour Party government who spoke about friends, family, and foreigners. And today, we are seeing the greatest revelation of who is pushing friends, family, and foreigners. Our ports now owned by foreigners. They now want to give our airport to foreigners. A little piece of land in La Clery, foreigners. Our Banan lands, friends. So we need to ask ourselves, was Labour Party prophesying to the people of Saint Lucia what they would do when they get into government? Now, Monsieur Février a parlé about ça. We want to give the La Clery people the assurance. No Nigerian investor will come and do a little project development in La Clery. If we welcome investors to Saint Lucia, but if an investor wants to come in and do something, it's not a retail shop you come in and put in Saint Lucia and for you to rent for locals. Let our NIC do it. Let our National Housing Corporation do it. Let a local businessman do it so that the money can stay in Saint Lucia. Mr. King, you have given our ports over as Minister of Ports to GPH. You not satisfied. You cancelled the airport project that you presided over and did the groundbreaking ceremony. You stood in the parliament and you said how great the project was. Now you've turned around, betrayed the people of Saint Lucia again, and now you all want to hand over the airport to a foreign entity. So if we don't own our ports, we don't own our airports, your main points of entry, what do we own in Saint Lucia? What is it that is wrong with this Saint Lucia Labour Party government, that everything that should belong to Saint Lucians, what is our patrimony, what is our sovereignty, is being given away to foreign people? And then the Prime Minister responds, 40 years later, I will not be around. Can you imagine if Sir John said 40 years or 50 years ago, he had said, well, I can do anything in St. Lucia because I'm not going to be around? What would we have inherited in this country? St. Lucia, ask yourself, why is Philip J. Pierre and his administration bent on giving everything that is valuable and viable in St. Lucia to foreigners? And let me give you one final example before I move to the next subject. Our courthouse. You went and you bought a piece of land, as far as we know, in excess of $14 million. And you go and lease it to a Trinidadian company for $1. Saint Lucia, gouvernement just gain un chote pour un $14 million. Ek yo ay loué terre pour $1 par l'année. Ek nou pou ay loué building nan ki la pour 12 l'année à $16 par pied. Can you imagine that NH is going to make close to $100 million from that? And while we talk about NIC will not be solvent by 2045, under a UWP government, NIC was going to finance that building, and the 100 million, close to 100 million that NH is going to make on that building, that $100 million under a UWP government would have gone to the National Insurance Corporation so that the pensions of our workers in this country could be secured. I will come to the NIC at another time, but I need to move on to other things, because ministers are in government for a reason. Now, my people of Castries Southeast have told me, you speak about everybody else's business and you leave our business behind. So permit me a little time to see. In the development plan for Castries Southeast, we were building a Bexar Town Center, which was stopped by the Saint Lucia Labour Party. That would include the indoor facility, the 2 playing fields, a racetrack or a dirt bike track, a swimming pool, outdoor courts, all of that with a housing development to the back. The lighting project of the Bexar playing field was stopped, and the lights in Odson Field has been off for the last 4 years because the government of the Saint Lucia Labour Party have failed to pay the electricity bill. In the process, they want you to believe that they are just lighting playing fields. Another election ploy. But they don't pay the bills for those that are lighted already. The Wavin Poisson Court has been abandoned. The recording studio that was being built was stopped, and the contractor is now taking legal action to be paid. The Forestier Community Center was abandoned, and our information is the land was sold. The Bexar Market was abandoned. all the steel is out there rotting on the ground. I want you to know that real economic growth is going to happen for the community and its environs when the cargo port is moved to cul-de-sac. That's going to generate major economic activity. And we are going to bring back agriculture, develop the road network. And so I want you to understand that what is happening here to us in Saint Lucia is a travesty being done by the Saint Lucia Labour Party. And so to the subject at hand, healthcare. Now, we heard the Labour Party recently at a meeting boasting about how well the economy is doing. So I want to ask Saint Lucia, if the economy is doing so well, why is healthcare in shambles in this country? And if you don't believe that healthcare is in shambles, here's what the Medical and Dental Association says. The focus of a significant proportion of the board membership appears to be solely on micromanaging and creating a toxic work environment as opposed to ensuring that conditions are in place to guarantee the best possible care for patients who present themselves at the institution. That is to fellow Saint Lucians. They say their key job is saving lives. Without basic resources, how are we to manage diabetes and its complications without glucometers to monitor blood sugar? Are you aware that the physicians have to bring in their own supplies to ensure that patients with diabetes and other life-threatening diseases can be taken care of? Now, I want to remind you, I have been in touch with many healthcare providers. I've been in touch with many patients. And the situation is not much better at the OKEU hospital as I speak to you. Still a shortage of beds. Still a shortage of medication and basic necessities. So while they boast about an economy doing so well, many of us have worked. That is what the letter says on page 2, last paragraph. Many of us have worked and sacrificed tirelessly at VH and OKEU for close to or more than 20 years. And we can categorically say, never has it been so bad. We have always been under-resourced, understaffed, and overworked, but it has never been so bad. So if the doctors and the nurses are saying, we all know we are not a first world country, so you cannot have every single thing that you want or you need. But they are saying, even though it's been bad at times, it's never been so bad. Since Damian Greaves became the CEO, where is he? What have you heard about him? Is he getting his salary every month? Is the hospital better today than it was? These are the real questions. So it cannot be that the Prime Minister is boasting about an economy doing so well. Healthcare is in shambles. National security or insecurity is out of control, especially gun violence. No new jobs are being created, but you boast about an economy doing well. How can the economy be doing so well while the cost of living is skyrocketing? Infrastructure is in a deplorable condition. All housing developments are at a standstill except the one started by the United Workers' Party, while ministers in the government have built more condos. The boasting of the GDP is not a result of growth, but overtaxation. And the taxation by the Saint Lucia Labour Party is killing the people of Saint Lucia. Moi vle di Jean Saint Lucie, Labour Party a Dubaï a fait tellement bien en Saint Lucie. Et là nous gade conditions santé, il pas dans bonnes conditions. National security, nous pas même parler about ça, nous pas ni ça. La pa ni pièce travail neuf qui ka ouvert en pays à côté Saint-Lucien ça joine travail mais à même laisse ça gouvernement les baka bay contractor work permit free of charge pour mener comme 100 moun sort l'autre pays pour vinn travail pour faire travail dat Saint-Lucien même ça fait. Bagay en supermarket là. Had soulier manger oui mettre tout bail pour y a ka monter chimé à dans vieille condition nous te dans motoke dimanche nous pate ça drive sort Couliton pour ay Belen nous train pour faire rôle ou pas mondo parce que chimé est tellement mauvais. Pas du temps nous ka parler yo di yo kay fait kay bay Jean Saint Lucie yo kay fait high rise building cul-de-sac yo kay fait common housing development sel moun nou ki ka build condo et housing development c'est minister gouvernement ka bati pour koyo yo poko bati yon kay bay a moun Saint Lucie parce toi ti kay la nou ka we en denri la rodia. So nou ka baw assurance a UWP government will reduce taxes that will ease the burden of the cost of living in Saint Lucia. And the Honorable Alan Chasney, when he returns as Prime Minister, has promised that he will remove the 2.5%. He will reduce the price of fuel. He will give a pension to the banana farmers. He will pay tuition for all students at SAAFA. We will implement healthcare insurance. All of that will make life easier for Saint Lucians. Now, healthcare. And let's look at this. Because Mavle just Dubai from Tetman. Mwen vle moutou sa Labour ka pon met ek sa yo ka deliver. So, sou manifesto Labour Party, mwen kay moutou yon deba yo te di nou. Sou page 37, 2011 manifesto. Misa yo di yo kay fe en santé. Yo di establish universal healthcare to provide a comprehensive publicly guaranteed package of health services to Saint Lucians. Develop accountable, efficient, well-managed public hospital. Ensure that all our health services are accredited according to international standards. They promised that in 2011. I want you to ask them how many of our health facilities have been properly accredited. Now, they also promised on page 38, it is our party's mission to ensure that every Saint Lucian have access to a package of guaranteed health services, In this term in office, our party will implement universal health care. Yodisa in 2011, they called elections in 2016, universal health care was not implemented. Now, I want you to understand why this is important. Because c'est pour mettre tout seul les bac à fait. Est-ce que ça tient c'est pour mettre là? So, let us examine UHC versus UHI. The Labour Party has promised you for decades, more than a decade, universal health care. It has not been materialized. The United Workers' Party is promising you universal health insurance. Now, let me explain the difference. Let us see what UWP did in healthcare. The 2021 manifesto on page 9. Let us examine promises made and promises kept. We offered you 5 to stay alive in 2016. We achieved all 5. We reduced VAT from 15 to 12.5. We reduced vehicle license fees. You remember the Labour Party had increased the license fees for all vehicles. Maybe people even forget these things already. UWP had reduced the license fees. We increased subsidies for the school feeding program and transportation program. We facilitated the exemption of property tax for 5 years. And we cleared all outstanding fees owed by citizens to Victoria Hospital. Outan sa mwen dia, nou te promet tout 5 pour être vivant. Nous baisser VAT là, nous baisser pour licence machine, nous increase amount l'argent nous te ka dépenser en school feeding programme là et en transport. Nous pas faire payer property tax pour 5 l'année et nous payer bill moun teni l'hôpital. Ça c'est ça nous te promet et ça c'est ça nous deliver. Eh bien nous délivrer. And gade l'autre bay nous fait because c'est pas ça seulement nous fait bay moun. Because dele moun ka parler. And gade sa gouvernement monsieur Chasne fait between 2016 et 2021. 2016 to 2021. Changer nous ten COVID et changer sa Kenny Anthony te dit about economy. We commissioned the OKEU hospital. We converted Victoria Hospital into a respiratory clinic. We refurbished and upgraded 14 health centers, or what we call wellness centers, island-wide. We constructed 2 new wellness centers in Mikud and Ancillary. We extended the operating hours at the Grozile Polyclinic to midnight. We increased the budget for the medical assistance to the public from $700,000 to $4 million. We established a framework for the introduction of national health insurance, and construction of the St. Jude Hospital was at an advanced stage. All of that we do despite COVID and the financial crisis that Kenny spoke about that we inherited. The question, Saint Lucia, who do you trust more to improve and handle the healthcare in Saint Lucia. Compare what UWP did and what Labour has done in their 5 years when they said the economy is booming. So, we promise you healthcare insurance to the tune of $75,000. And Labour Party tell you that cannot happen. Let me tell you why Labour Party tell you that cannot happen. You know why? Because they are failing to pay the insurance for the police officers, while the Labour Party Prime Minister is telling you everything is there, tout bay la, l'argent la, yet still pas pay. So the same UWP government who implemented, negotiated with the police to get a healthcare insurance in place for them, and we did it for the police with the cooperation and the contribution of the police officers, we are going to do the same for the entire population of Saint Lucia. And here's how it's going to work. Now I want to tell you, the Labour Party engaged a group of consultants. Yo mene yo sorti mwende se l'Amérique ek yo vini pou di yo ki sa pou fe ek healthcare Saint Lucia for universal healthcare. Right in this room where I am standing here today, the opposition was invited to meet with the consultants. We met with the consultants. I came with my notebook, I sat at the table, and I was taking notes. One of the lead consultants stood up and said to me, "You don't need to take notes. The PowerPoint presentation that we are making will be submitted to everybody who is present at the meeting today, at the consultation." 3 months later or more, I have made inquiries on every occasion whether this presentation has been sent. Up to a day like today, the consultants and the persons responsible have not responded. This is gross disrespect to the office of the leader of the opposition. We left our busy schedule. We came, we sat in a meeting with you, Mr. Consultant. We took our time. I was taking my own notes. You so directed me. But you see, I don't need to write to remember, because I still remember what you said at the meeting. You said y'all have not fully figured out how y'all are going to finance it, but it's a new tax that is going to be, the proposal is to introduce another 2.5% tax on the existing taxes. In fact, about 3% tax to finance universal health care. So that is the Labour Party plan. Plan Labour Party c'est pour hausser VAT pour 18%, 18% in order to finance universal health care. A UWP government is giving Saint Lucia a better option. We are going to remove the 2.5% health and security levy. Our plan is to reduce VAT by another 2.5%. So we are going to reduce taxes by more than 5% overall. And we are going to ask those who are working and can afford to make a small contribution towards the health insurance. Those who are not working, and we have worked out the figures, 40,000 families or individuals in Saint Lucia. 40,000 moun pasa paye because either yo pa travay, yo ha pension, et bien l'argent yo ka fe a trop bas, so yo pasa me $5 aside towards health insurance yo. Un gouvernement, Monsieur Alan Chasney, gouvernement UWP kay paye $40 million by 40,000 moun sa ki pasa paye pour health insurance yo. Now, Saint Lucia, it is clear we are not giving you a 6 for a 9. We are not promising you something. We have done more research than the consultants that they have paid. We don't know how much 100,000 they paid the consultant. We have never heard from the consultant again after that initial meeting. Now, here's what we are saying to you. Government was spending $35 million to run to run Victoria Hospital. They said OKEU was going to cost 75. We know now OKEU is in the region of 120 million. Government was just making a subvention, I think, of about 18 million to St. Jude. And St. Jude had to raise the rest of the money to run itself. The new St. Jude is going to cost more to run. Where is that money coming from? If the government cannot adequately operate OKEU today, OKEU is a mess under the Saint Lucia Labour Party. Healthcare is a mess. What do you think is going to happen when you have to run a more expensive St. Jude hospital? So we know that it is better to have healthcare insurance, and the insurance can claim, or the hospital, when you visit the hospital. So unexplain sir. Mwen hani healthcare insurance, mwen klani about presque 20% Saint Lucia, 20% of the population already have the health insurance. The rest of the population. And there are different things being worked out as to how it is going to be rolled out. The rest of the population in St. Lucia. We've said everybody in the public service below grade 10, because of what the salary that they make is too low, the government will pay the full health insurance premium for them. All the pensioners, all the unemployed, all the single mothers, all of those persons who do not have an income within a certain bracket, the government will pay the full insurance for them. Now, si moun ki sa afford sa paye pou koyo, ek moun ki pa sa afford, se responsabilité gouvernement pou paye ba yo. Ki pli bon plan ou sa ni pase sa? So nou pa avini faw an pomet dat nou pa sa chen, nou ka faw an pomet dat nou sa chen. And as soon as you elect the United Workers' Party into office, we will begin the rollout of the universal health insurance, or the national health insurance, because it is national health insurance that we are talking about. An insurance that covers your services at the various health institutions. It will cover some private doctors' visits. We have not finalized our negotiations in some of the areas of dental services, but we are looking that all of this would be part of the rollout of national health insurance. But the basket of services that will be covered will be comprehensive in terms of meeting the needs of healthcare in Saint Lucia. The Labour Party want to confuse you and make you believe that national health insurance is not possible. It is UHC that is not possible, because after more than a decade of promising you universal health care, and I'm trying to get the manifesto of the Labour Party 1997 and 2001. So if anybody have a copy, you can share with me. But I want to go back. I have them, but I have so much documents, I have not been able to find them. But I want you to go back and see how far back Labour Party has been promising us improved health care, and it has not materialized. I know that our political leader, the Honorable Alan Shasney, as a visionary leader, will deliver for the people of Saint Lucia on our 7 SOS plan. 7 plans or pointers, save our Saint Lucia. Ek pour tout moun qui malade, pour tout moun qui n'poy wè docteur, pour tout moun qui ka katile lè, yon a ti l'opération pour faire, qui manière yo kay payer pour li. Pour tout moun qui ka di, well, yon pou fè ti fundraiser, an danser, an barbecue, an GoFundMe. Lè ou vote by gouvernement flambeau, ou pas qu'à pour faire pièce fundraiser encore, ou pas qu'à pour faire barbecue pour ça payer bill l'hôpital, et bien pour aller voir docteur, et bien pour faire l'opération. Et moi-même, quand un membre partisan flambeau, moi satisfait, et moi voulais dire expressement, moun en Castries Southeast, les ou vote by UWP en élection ça a venir. Tout moun en Castries Southeast et en tout 17 constituency en Saint Lucia kay ni yon 4 insurance qui ka ba ou coverage et ben kay couvert 75,000 $75,000 ou kay ni pour sa payer pour santé ou pour service santé ou. C'est pas ou ka payer 75,000 ou qui pas travail gouvernement ka payer c'est $1,000 il ka vini pour insurance là à peu près $1,000 pour l'année. Moi v'lou comprendre ça. So à peu près $100 par mois. C'est ça premium la cahier. Et le gouvernement ka paye parce que les nous garder between mamay et moun qui Saint Lucia. L'année et nous sa ki jani insurance yo. L'année à peu près 100,000 moun en Saint Lucia qui besoin health insurance la qui passe for point déco yo. Parce que ou kay ni un plan pour famille. So les maman ni 2-3 chèque c'est la en bas l'âge de 18 ans yo kay en les plan family plan. Because nous qui ka prend insurance pour une famille nous savons ka prend package by famille. So la kay ni a peu près 100 package 100,000 package insurance. Et gouvernement ka paye presque half adan 40,000 en ces plans ça gouvernement UWP qui paye pour ça. So Saint Lucien pas quitter le Labour Party connaît encore. Yo haba nous promettre en 2011 yo pas chenni. Mi term Philippe J. Pierre Cavini a dans bout ou pas qu'attendre yo ka di rien about universal health care encore. si ou te vote bay flambeau dernier élection, ou te jani health insurance ou abwezan. Ek le ou vote bay flambeau, le yo kouye élection sa, nou ka ba ou asiwanson. That health insurance a kay en place, ek tout Saint Lucia kay sa dormi en wipo, ek le yo jwen a malade, le yo touve koyo malade, le yo jwen koyo a da accident, le an ba yive yo pa kay ni pou gwate tet yo. Le yishou malade, enbe maman ou ek papa ou malade, ou pa kay ni pou van chote, ou pa kay ni pou doubout ale l'école, ou pa kay ni pou give up an yen ni pou sa paye, pour santé, et bien pour point que santé c'est moun ça, parce que c'est pour ça moun ni insurance. So, moi ka parler by tout moun. Choice là c'est ça ou pour faire. Nous ça on ni au fait ba ou. Nous pas ça faire au point si ou pas vle. Kachile autant moun qui ni diabetes, qui ni high blood pressure, qui ni cancer. Sou ay we docteur ek le insurance a besoin vo ay we docteur avant yo ba insurance. Yo ka dou non, yo pa isa ba insurance. Gouvernement kay passe loi pour mettre bagay en place. That insurance la kay accepter tout moun. Ou pas pour ay visite pièce docteur pour joindre ko accepter en bas plan insurance that nou ka presente. So as I close today, I want to say to Saint Lucians, you can examine everything that is being said. We are not playing games with the health of the people of Saint Lucia. In 6 months, less than 6 months, we were able to convert the Victoria Hospital into a respiratory hospital. The Prime Minister has still not been able to open St. Jude's or to even give a definitive date or time when they are going to open St. Jude. I can alert you and tell you what they are going to do. Their plan is to do a handover of the hospital and close it just as they closed OKEU after they did the naming ceremony. But in their own manifesto, it says that the hospital must be accredited. Health institutions must be accredited. I want to see which institution is going to accredit the makeshift hospital that the Labour Party has spent $400 million on. We await. Do not be fooled. They will try another gimmick with the opening of St. Jude. Keep your eyes open. Don't allow yourselves to be fooled. And St. Lucians, read, pay attention. Do not just take my word for what I have said today. Go and verify the information. Get the Labour Party manifestos, and you will see for yourself that everything I said about what they promise is in there, and not one of them has been fulfilled. Let us make the right choice. Let us vote for the government that has a proven track record of delivering on its promises. The government with the track record of developing Saint Lucia. The government of the United Workers' Party. God bless you and enjoy the rest of your day.